Welcome to Healthy Buzz, the podcast for women who are craving honest answers in a supported community. Hosted by Brandy Homerding, a certified nutrition therapy practitioner who believes your body isn't broken, but the narrative around women's health is. Each week, we're diving deep into holistic health topics, challenging the one-size-fits-all approach, and empowering you to trust your own informed intuition. Get ready to feel seen, supported, and seriously informed. This is Healthy Buzz, where collaboration meets unfiltered transparency in women's health. Today, we are going to talk all about fibroids, and joining me for today's talk is Dr. Katashia Partee Kendrick. Dr. Katashia is a clinical pharmacist, integrative health practitioner, certified sound healer, and the passionate founder of Dr. Katashia Wellness Collective. After surviving a decade-long battle with fibroids, living with stage 3 endometriosis and infertility, which ended in a hysterectomy that shattered her dreams of motherhood, Dr. Katashia transformed her deepest pain into purpose. Today, she is dedicated to helping women navigate their journeys holistically, from periods to perimenopause and beyond. With one foot in conventional medicine and one holistic healing, she bridges the gap to care and conversation that have kept women suffering in silence for far too long. Dr. Katashia is on a mission to educate, empower, and support women because she believes our stories deserve to be heard and our health must be prioritized. Wow, Dr. Katashia, I'm so excited to have this conversation with you today. Welcome.
Thank you so much, Brandy, for having me. I'm truly grateful for being here. Thank you.
So I would love to hear a little bit more about your story, your journey. You know, you mentioned that you had fibroids, stage 3 endometriosis, ended up with having a hysterectomy. Can you fill me and our listeners in on about your journey?
Yes, thank you. Fibroids. When I hear the word, I kind of shiver a little bit. When I think about Lion King and it said Mufasa, they kind of shiver. That was me when it comes to fibroids, because that was my life. My whole life has been planned around my period. It all started back in my early 20s when I was in pharmacy school having a lot of issues. And I've looked back when I was in high school, I've always had issues with heavy bleeding, cramping, blood clots. It was a mess. But my mom, my aunt said it was normal. So I kept going. And when I was in pharmacy school, that's when I literally knew something was off, because a blood clot that I've been waiting to fall all day, finally it fell during my exam. And when I tell you I had a mess in my seat, I was embarrassed, but I knew I couldn't get up. So that was in the fall of 2001. And in the spring, that fall, I ended up going to the doctor, spoke with my mom, came home from school, and that's when I was diagnosed with fibroids. Never heard of it, had no idea what they were. And yes, she told me they're non-tumorous tumors, but you have a lot of them and we need to do something about it. And I really thought once I had them removed, because my only option due to the size, she said some were cantaloupe size. I had grapes, but she said I had so many, and the way they were positioned, I needed an open myomectomy, which is the removal of the fibroids. So I'm like, sure, is this going to fix me? I was down for it. Had the surgery in the spring of 2002, and I thought I was fixed. I thought everything was great. I'm back to, normal periods. I was still heavy, but I thought I was back to my baseline. And 10 years later, they were back. In the time, I'm still going to the doctor. I'm still doing the things I'm supposed to do. But nobody told me about fibroids until I went in having those symptoms again. And that's when another doctor said, oh, you have fibroids. And I'm like, no, no, no. I had those removed already. So what are you talking about? And that's when I learned that they grow back. And I was devastated. And he said the same thing. You have so many, they are all over the place. Because if you saw me, you would think I was like 6 months pregnant, because my stomach was just poking out. But I just met this guy and I was like, I'm about to get married. And I didn't want to deal with another surgery, but I had to, because one of our dreams were to have children. And the doctor said the way they are, you need this surgery or your quality of life just wouldn't be great. And he's right, because I'm living out of a bag. I have bags everywhere because I may mess up my clothes. I have pads everywhere. So I decided to have another surgery. And at that surgery is when I learned I had stage 3 endometriosis. So I'm getting like sucker punch from all different places right now. So now I'm living with fibroids, have endometriosis. I'm like, goodness. But I did get married and we were going at it, trying to have children. And every month when I got my period, a part of me died because I wasn't understanding what was going on with my body. And at that time, that's when we decided to kind of look a little bit deeper and come to find out, Brandy, for the third time, my fibroids were back. And they grew
Wow.
back so fast. This time, I was fainting, I was anemic, going to the cancer centers for my iron infusions. It just became a whole lot. And ultimately is when she made the decision to have a hysterectomy, never been pregnant. And that totally devastated me. My life was truly turned upside down.
Yes, that is so heartbreaking to hear your journey, the struggles that you're on, and like to hear that it recurs. Like a lot of times people maybe don't even know. They think I have this
Right.
surgery and it's going to take care of it, and then I don't have to worry about it again. But then we can see that like it is recurring. So, can you describe for our listeners
Yeah.
what is a fibroid?
Yes. So fibroids are non-cancerous, benign tumors. They are found in the uterus or on the outside of the uterus. They can actually grow in different places and they can actually grow on the outside on the stalk as well. So they can grow inside and outside and grow to as big as a cantaloupe for some. I've had over 100 fibroids in my body total from all three surgeries.
Wow.
Yes. And it's funny thing, I've seen pictures where they had teeth, some had hair, they're like little creatures. They're pretty ugly, but they are a nuisance for sure.
What are the symptoms of a fibroid? Because somebody might be like,
Yeah.
wow, how would I know if I have a fibroid?
So usually fibroids start with pain for sure. You in pain. You will have truly a lot of heavy bleeding and to the point where you're soaking through more than 5 or 6 pads in a day with your period. So if you're thinking about pads or tampons and you're going through 5 or 6 of those, and you also notice severe back pain. That's a problem with fibroids, and I had that back in my time at that time back in the early 2000s. I didn't really associate the lower back pain with fibroids, but lower back pain because they're sitting on different places in your body. My fibroids were actually so big they were smashing my bladder. So you can also notice frequency, urinary frequency as well.
Yeah, that heavy bleeding thing is something that I definitely like talk to my clients about as
Hmm.
well. And like, hey, if it seems abnormal, like how many menstrual products are we going through? Is it like
Exactly.
flooding? We have to understand what is going on here. So, how would somebody get diagnosed with the fibroid?
You will go in honestly through your providers, stand on top of your well woman exams, and they can actually be seen through examination. You can see them on the ultrasound as well as an MRI. And I truly recommend both of those. A pelvic ultrasound, also an abdominal ultrasound can actually see them as well, and an MRI can
Mm.
officially diagnose you with fibroids.
Yeah, something that we should definitely be advocating for if you're
Right.
having a lot of these symptoms. So, when we think about symptom management and like a conventional approach
Mhm.
to managing these symptoms, a lot of times women are given non helpful recommendations. And what I'm referring to here, I'm kind of beating around the bush. A lot of times providers will be like, just take the birth control pill. This is going to solve all your problems.
Mhm.
Did you ever have that experience? And was that something that you tried to help with managing your symptoms?
To be totally honest, I did. I went on birth control pills thinking it would actually help with my bleeding, and it did not. I truly must say it was a waste of my fucking time. I had to say that because
Yes.
it did absolutely nothing. It felt like if you're thirsty and you get like a little drop of water, that's what they did to my fibroids and my symptoms and my bleeding. Absolutely nothing. I know now with conventional medicine, it will tell you watchful waiting. Let's wait and see what happens with your fibroids, right? Because some may have them, they may not grow anymore, may not have any issues. But then they'll say, oh, let's put you on birth control and help you with the bleeding. It did absolutely nothing for me, but I can't say it won't help the next person. But for me, I came off the birth control, but that's when I decided to have the surgeries, which is another way I mentioned that you can actually have your fibroids removed. But there's other options now. You have ablation and different procedures like that as well.
With the fibroids, do we know what makes the bleeding so heavy? Like, what is it about a fibroid that contributes to that?
It's based on usually the location of where they are in your uterus. if they're deep in your uterus, but usually the location is the reason why that bleeding actually caused so much. And also they look at even our lifestyle. They look at certain things that we're doing when it comes to endocrine disruptors and different things like that could be a part of the reason why you're having that heavy bleeding.
Interesting. So when we think about root cause of fibroids, are there some things that we are doing as women that may be contributing to the development or growth of fibroids? And are there things that we can do that also can support a woman that have fibroids? These are kind of both big loaded questions. So
I
take your
know.
time answering them.
No, and it's fine because I always think back for me. I'm 20 years later in this process. When I was going through this, there weren't a lot of resources available when I first started in this journey. But when I look back now, I think about those things that I could have been doing for me to help reduce or help with the pain. Of course, I mentioned nutrition. So a lot of times they talk about red meat and sugar, dairy, those inflammatory types of foods that can help. Also, those endocrine disruptors, watching what you have in your house, detox yourself, as well as detoxing the things that you actually put in your body from endocrine disruptors. And I keep saying endocrine disruptors just in case people are asking. It's just things that mimic your estrogen. It can cause other issues like fibroids as well as herbal support. I think about the different teas or tinctures that you can actually do that can help with your fibroids. If you're in a conventional mindset, a lot of times people do not want to do that. And I get it. But that's why I said I have one foot in conventional and another foot in the holistic space, because I truly believe there are other ways of healing our bodies. And if you would have asked me this question 20 years ago, I would have said, hell no. But now I know better. And so that I know that the way we move our bodies, if we're just sitting down, being stagnant, that can also be an issue. Start moving our bodies and reducing our stress. You can also get rid of people, get rid of things, and get rid of places when you're dealing with fibroids.
I love this that you said about like detoxing your home, but also what are we detoxing from our life? Who are the people? What are the jobs, our toxic jobs that maybe we need to get away from, the toxic people we need to get away from and put boundaries up? Like all of that can definitely be contributing to your stress.
Exactly.
With the detoxing your home, what are we specifically like looking for there? Because I know that that's kind of a big umbrella and somebody might feel really overwhelmed and be like, well, what does that mean? How do I detox my home? What are the things that might be contributing negatively to my health or be like an endocrine disruptor?
Yes. I always tell people don't go in your home and throw everything away, because that's how I mentally started. But I slowly started to remove things from my house. Candles that I was buying with all those different scents. Now I'm really big on the candle, the type of wax that I use. It's just made with essential oils. Also, the different washing powders and the things you put on your body when it comes to lotions, washing powders. If you're using dryer, sheets versus dryer balls, now we use that. So it's little cleaning supplies. It's those little things that I actually started to do to detox my house. Now, my husband was totally freaked out. Like, what the fuck is where are all the dryer sheets? Where are all these things? And that's when I started to explain to him about my conditions and what I feel like it'll be really good for us to start using. Yes, he got on board, but in the beginning, he was like, I can't find this, I can't find that. But that's what I mean by detoxing your house. And even when it comes to the different fruits and vegetables, I wasn't big on buying organic in the beginning, but now I am. There's just certain things I allow in my house and certain things I do not.
Yeah. And the reason why this is really important too is like our skin is our largest detoxifying organ.
Yes.
And the things our skin comes in contact with when we think about our personal care, our body care, things like that, and our cleaning supplies. We want to make sure that like the things that can cross that skin barrier and get into like our blood and things like that is not going to cause more damage to our body. Other things that we think about when we think about like a toxic environment is mold. This is a big thing for me in the Pacific Northwest, but mold definitely can have an impact on somebody's health. Do you have any experience with mold?
I do not. I actually was in a group. It was my mentor, and we had this conversation about mold and infertility. And I told her I had no experience with mold. And come to find out, it was a group of 5 of us, 5 ladies in this space, and all of them had experienced issues with mold and getting their house remediated. It was seemed like it was a freaking nightmare with them trying to get out their home and out of their body. And one of the things that I actually started doing in my practice is that's one of the labs, a mycotoxin lab that I actually started running with a lot of my clients because I didn't realize how prevalent mole is, and especially when it comes to women with fibroids, just infertility in general. And starting from that space has been really good. And honestly, I personally do not have any issues with mole, but working with women and also being in this group, learning about it has been fascinating because I actually had a friend in this group that had issues with mole. One, she had to move. She had to leave her house because the mole was actually growing near her bed and she was trying to get pregnant. I could not believe that. I had no idea mold can cause so much. And one of the things she told me was that, it didn't start today. Think about when we were little in the homes with your grandmother at your grandmother's house, or if you're in your damn dorm room back in college. All of that can affect you now in this age. And so, no, I personally do not know, but I know much more about it now.
Yeah. So I personally had experience with mold toxicity actually when I lived in Denver, which people don't associate
Wow.
Denver with being a place where there could be mold. But I think part of that was one, my immune system was probably pretty compromised. I was working a
Mhm.
ton before that. I was also in conventional medicine. I was an interventional radiology tech prior
Okay.
to becoming a certified nutrition therapy practitioner. So we have a lot in common as well, having experience in both worlds.
Right.
But I was working a ton. I was definitely stressed out. We had some water damage in our basement a couple different
Wow.
times. We had to live in our basement for a while too while we were renovating our upstairs. And it was a finished basement, but still, like, I think it was in the walls and the carpet, even though we replaced the carpet one time. Then I was also working at a very old hospital. And there was
Mm.
often issues with humidity levels. And I often remember seeing like tiles that had water stains on them in our department. So I was probably in that environment as well.
Oh,
And we have to think
wow.
about our body should naturally be able to detox from that. But when our detox pathways are compromised, when
Mhm.
we have a lot of immune things going on, if we're hella stressed out,
Yeah.
body's struggling to detox appropriately. So, yeah, it
Oh,
can have
wow.
a significant impact on the body and your hormones as a whole. And you do have to get out of the environment to heal from it.
You gotta get out the environment. I just didn't realize that. And even with family members, I know my brother mentioned some water damage in his home, and I told him about that because I have a niece. She's 16. So I
Mhm.
mean, outside of my brother having sinus issues, I'm thinking now that I'm having those conversations more about mold, I'm like, you really need to get that checked out.
Yeah, we're not trying to light the mold alarm, but we kind
Oh
of are
no.
trying to light the mold alarm here on people just to have you be aware of it. Anytime somebody's like, "Oh, we're looking at renting this place, but there was like water damage," I'm like, "No,
Like,
do not
no,
move there.
don't do it. No,
Nope."
don't do it. Because
Trust me.
no, I know someone else from the group that I was in, that was her issue. Water damage in her apartment, rented it, and had issues, so many issues.
Hey, Healthy Buzz community. Have you been curious about using a continuous glucose monitor to unlock powerful insights to your metabolic health? Imagine seeing in real time how your body responds to different meals, different workouts, and also the effects of stress. Now, what if you could experience those benefits without being locked into any type of recurring subscription like some of the other continuous glucose monitor programs out there? With my Blood Sugar Savvy course, you'll get exactly that. You'll receive access to 7 engaging learning modules, 2 continuous glucose monitors to start your wellness journey, plus 4 weekly one-on-one video strategy sessions with me where I'll personally guide you to understanding your CGM data. We'll work together to identify your unique blood sugar patterns and create customized strategies for better energy, mood, and overall well-being. Oh, and by the way, this is especially crucial during your peri and postmenopausal years. Blood Sugar Savvy is about understanding your body on a deeper level, implementing practical strategies, and gaining sustainable knowledge to support your overall health and wellness. Ready to get Blood Sugar Savvy and take control of your metabolic health? Healthy Buzz listeners can save $30 simply by using the code BUZZ at checkout when you enroll at bcw.bcollectivewellness.com/Blood Sugar Savvy. That's bcw.bcollectivewellness.com/Blood Sugar Savvy. Don't forget to use that code BUZZ at checkout for your $30 savings. Your personalized blood sugar journey starts now. So this is just going to have a cascade effect on all of your hormones. It can make these, if you have the underlying issues such as fibroids or endometriosis, big correlation there with endo. Do you want to talk a little bit about endo and like what some are the symptoms about endo? Because I think that is important. We do see endo often with fibroids.
Yes, endometriosis. I was actually shocked, but not shocked when I was diagnosed. And 10 years later, it usually takes about 10 years before you can even have a diagnosis. One, but also it kind of let me know that I'm not crazy because my periods were so, it just seemed like they were just odd, like the heavy bleeding and that's flooding and messing up my clothes. I'm like, it just gave me another answer, another puzzle piece to like, okay, what is going on with me? But endometriosis is endometrial like tissue that is growing on the outside of your uterus. So it's not the actual tissue, it's tissue that's similar to that. And one thing about this tissue, it doesn't just stay growing on the outside of your uterus. It can actually grow and attach to different things, of course, right? So it can attach to your intestines. That's why I was always constipated and couldn't understand because those lesions have literally just kind of smashed my intestines. I also learned that later on during this journey that endometriosis can just travel up to your lungs as well as to your brain. Me currently with being in stage 3 is right now is still in my, I guess, my lower area. So it's not in my lungs. It hasn't traveled anywhere. I have found a way to manage the symptoms. Yes, I had a hysterectomy and let everyone know getting a hysterectomy does not cure endometriosis. So even though I had a hysterectomy, I still suffer from those symptoms and having those flares. And that's where holistically I've learned to watch what I eat, move my body, stress reduction, the same things I was doing with fibroids. But the one thing I did not do when I had fibroids that I know now with endometriosis is a pelvic therapist. A pelvic floor therapist has really changed my life to help me to manage those symptoms and those flares with endometriosis.
Yeah, absolutely. We recently had on the podcast both somebody who discussed in depth endometriosis and a pelvic floor physical therapist. So people can go back and listen to those episodes as well to learn about why this is so important when it comes to the holistic person and addressing health holistically.
Right.
So with the fibroids, you mentioned like often people are given a surgery first option. Well, we talked about the birth control, but then also the surgery option. What message do women need to know about when they feel like surgery is the only option? And is that really the only option?
If surgery is your only option, I would recommend a second opinion. That's one of the things I really stress to my clients, people coming to have a discussion about fibroids and what to do next, because I didn't do that. I can be transparent now, years later. My goal is to be the guide for the person coming behind me, being that person that I did not have. And to tell someone, you talk to one doctor, get a second opinion and see if that's necessary. And also ask them about the different options outside of having that myomectomy, which is the removal of the fibroids. It could be that you can have a less invasive procedure, like I mentioned before, like an ablation or the UFE, the UFE. There's other options before you go deeper into that myomectomy. Now, if this is something that the doctor has mentioned after you've had 1, 2, maybe 3 opinions, now that you have the information, you can make a well-informed decision and know what's best for you. Because I would never tell you what's best for you. So you have the information, and now it's time to make the decision so you'll be able to live a great quality of life, because that's what's important. You don't want to live around your period. You want to make sure you put your foot down and live for you.
Yeah. Let's talk about what these different options all involve. So you
Okay.
mentioned an ablation, a
Yes.
UP, which I worked in interventional radiology, so we did the UPs, the myomectomy and the hysterectomy. What is an ablation?
So an ablation uses heat to actually destroy the fibroid. The UFE, which is the embolization, it actually cuts off the blood supply to shrink the fibroid. And the actual myomectomy, it removes the fibroids. And remember, the myomectomy can only take so much. So yes, they can take all these fibroids out, but it's still a possibility that, of course, they can't get all the little ones and they could grow back. And then you have a hysterectomy. Of course, they remove the uterus and take everything out. So those are the 4, common options for removal of the fibroids or reducing or shrinking.
Yeah. And it kind of sounded like, as we talked about those, it kind of goes from like, I could be wrong, like least invasive to
Most.
more
Hmm.
invasive. Yeah. So it's
Hmm.
kind of exploring these options. Are you a candidate for an ablation? And is that going to support you in your fibroid journey? Or do we need something a little bit more aggressive when it
Right.
comes to your specific situation? Everybody's so unique and individual. So I love what you said about like getting a second opinion,
Yep.
finding out what the
Oh,
options are.
exactly, because even with the myomectomy, you still have an option to bear children. Which one is it? I'm not sure if it's the UFI or the ablation where you need to be careful. If you're looking to actually conceive, you need to make sure that's an option because if not, then you have cut off, your way of conceiving. So just
I think
making
that's the
sure.
ablation.
Yeah, I think that's the one that destroys it. So my point
Mhm.
is just making sure you actually know what you're looking to do. Because if you want to have children, then the myomectomy and the UFI could be your option versus a hysterectomy or even an ablation.
Yeah, exactly. So with the hysterectomy, there are options whether we are leaving the ovaries or not
Yes.
as well. There's different levels. Do you want to describe that a little bit more for our listeners so they know about those options?
So for me, I can most definitely tell you I had a partial hysterectomy. I did not have a full. I was 36 years old. And my doctor and I decided I did not want to go into menopause at 36. So I had a partial where I had my uterus moved and I still have my ovaries. I still was dealing with an ovarian cyst, but I decided to keep my ovaries to kind of just naturally go into the next phase of womanhood. But you also can have the full hysterectomy where you actually have your uterus, your everything removed, including your ovaries, which you will go straight into menopause at that point.
Yeah. So with the partial hysterectomy, if you keep your
Mhm.
ovaries, you're still going to have the
Like
cycles, just
so
not the bleed.
that is correct. So my body still felt like I was still cycling. So I was still ovulating, doing all of the things if I had a uterus. Ultimately, of course, I did not bleed. And one of the things about that, my body still reacted and I still flared because I had endometriosis. So my
Hmm.
body didn't know otherwise what was going on. So now I'm in a stage where I'm 47. So now I'm going through perimenopause. So now I'm going through that stage. And it's so interesting how going having fibroids and having endometriosis, you're more self-aware, you're more body aware of what's going on. And that's one of the things I really learned in this holistic space of learning what my body is doing and actually giving myself permission to feel the feels, to know what my body is actually doing. So now that I am going through perimenopause, I can know exactly when. Now I haven't ovulated because I noticed all of that when I was 36, 38, when my body thought I was still having a period.
Yeah, yeah. So we can describe for the listeners a little bit. In this perimenopause stage is when we are not in later perimenopause. It's the stages leading up to menopause. And so ovulation can sometimes become a little bit more sporadic or not as
Mhm.
robust. And so we're not having the same progesterone pulse that we have with a normal cycle, like when we're in our 20s or in our 30s and not on any type of hormonal birth control.
Right.
So when you have this hysterectomy, if you have a partial hysterectomy, you still get to ovulate and have the benefits of those hormones. You just don't have the bleed accompanied with that, like 12, 14 days later to signify that like a new cycle starting, right? So there are other metrics in which you can track your ovulation. Do you use any of those?
Now, before I was using an Aura ring. That's what I actually use. And now I've noticed that, of course, it's dipping the different things that's going on for me. And what I've learned, just even in the different certifications that I've taken, there are many devices that you can use now, which has been amazing, which I didn't know about until recently because I've been stuck on learning more about my Aura ring when it comes to stress and ovulation. So now I'm totally stopped right now. And it's been a great opportunity to learn, continue to learn my body, knowing that it's amazing at these devices and what they can do. I look back now over 20 years when I was going through my infertility journey and just IVF and all these things that I did not have an opportunity to experience, but to be able to take charge in perimenopause and be able to know when I'm ovulating and when I'm not is so empowering. And that's one of the things I always want to tell my clients that I've never used, say, the menstrual cup, or I never used all these things, but I've learned and been able to be in this space in women's health to be that person, to be that guide. Now, do I advocate for the different devices to understand your body when it comes to your period tracking? Of course I do. but also I'm still old school too. And I love to just pay attention and be able to be in the space to be aware of how my body feels, to be able to know what feels great to it and be able to not do it if I don't want to. So that's where the empowering space comes in for me as well.
Yeah, I love that. So with the Aura Ring, I do use the Aura Ring. I love data. So I do take my temperature in the morning as well, just to see if it's correlating, because I'm like, want to make sure. But so with the Aura Ring, what we're talking about is that you will see a temperature rise in your luteal phase after you have ovulated. So on the Aura Ring, you'll see your temperature shift up
Right.
afterwards, and that will signify, hey, ovulation occurred. Progesterone is thermogenic, and so it raises your basal body temperature. So then you have that increased temperature throughout your luteal phase. And when we go through perimenopause, then we can start to see like, oh, did I ovulate? I didn't have a temperature shift, right? I didn't have a temperature shift. So that's one way of tracking. Another thing that I really like to use that's newer that I've been using with some of my clients as well is Mira.
Mira, yes, I heard about Mira. I have no experience with that, but I know a lot of my clients have asked about it, and I learned about it when I recently did a women's health certification.
Yeah, I love Mira. It's been really, really insightful. And for me, I decided I was going to track this cycle, and I ended up getting COVID on the same day that I
Oh, no.
ovulated. So my luteal phase, my progesterone has been in the dumpster this whole cycle. I'm like, I'm ready to move on to the next cycle. Let's see what happens in the next one.
How long you been using this device? I'm just interested.
Mira, I started using in December
Okay.
for myself. And like, this is on I kind of hit and miss, as I'm not consistent every month using it. But
Okay.
then I started seeing a really good benefit for a lot of my clients too. And so usually with some of my clients who are having irregular cycles or really heavy periods, or they're not sure if they're still ovulating because they're in that perimenopause, or they've had like a partial hysterectomy,
Mhm.
we'll use Mira to help us with maybe the timing for their hormone testing too. So
Okay.
like if we're doing a Dutch test or salivary hormone panel, or even just going to the lab to have more labs drawn, so we can look to see timing of that, so they're not wasting their money on a beautiful Dutch test that does cost a little bit more money.
Yes.
And it's really helping us to link together when they're having symptoms, because you're getting the whole cycle worth of data instead of just like one day snapshot. So highly
Okay.
recommend.
Okay. I will have to look into this. I learn every day, so thank you for that.
You're welcome. You're welcome. Is there, because you mentioned this to me, but I think it's important for our listeners to know as well, is there a population of women that are more disproportionately affected by fibroids?
Yes. So up to 70 to 80% of Black women will develop fibroids by age 50, compared to 70% of our white counterparts. So more
Wow.
Black women experience issues with fibroids. We are really extra sensitive when it comes to the estrogen as well. So you notice that we're going to have more heavy bleeding, more of the blood clots, more of those symptoms associated with fibroids. Don't get me wrong, there are women living with fibroids that don't have those symptoms, but usually those symptoms come along with fibroids when you're Black. What's so crazy is that even at younger ages, we start to see more fibroids now. They're usually larger in our population, as well as these symptoms can be so triggering that we're missing work, we're missing school, we're missing important things in our lives where that start to affect our mental health. So when you may see depression and just body image issues, because now, like I mentioned, I was having fibroids and it looked like I was 6 months pregnant. And can you imagine someone asking you if you're pregnant, you're just dealing with fibroids. So it's so many things that go along with this that can happen, not just the symptoms, but also the mental health issues that can come with it as well.
Yeah. What is something that you feel like you could offer to women to help advocate for themselves when it comes to getting better fibroid care?
I believe that to be able to advocate for yourself, you got to ask questions. One of the things I work with several organizations where I volunteer, where we're able to come up and help. We have different things on our website where we're able to show them and help them the certain questions to ask when they go to their doctor's appointments. If they ever feel dismissed, we always tell them get another doctor. Find community, because finding community truly helped me through my journey of infertility. When it comes to fibroids, endometriosis, so many women out here suffering, but finding that space, finding that safe space for you is important as well. And being prepared for appointments and knowing your body. knowing your body is important as well, but knowing your body to the point where I didn't let my doctors tell me what was good for me. I wanted to know all the information and be well informed. So I think those are the top things for women trying to advocate for themselves to be able to get into those appointments and be prepared, change doctors if they feel like they're dismissed, and find community and know their body.
That sounds so beautiful. So I know that you have a Dr. Katashia Wellness Collective. Can you tell us a little bit more about what that is for those
Yes.
who do have fibroids and want to maybe learn about where they can find this community?
The Wellness Collective is very near and dear to me. It was literally birthed from my pain. My pain was dealing with fibroids and living with endometriosis and infertility. So, the Wellness Collective is my wellness company to help women prepare their bodies for pregnancy, women going through the different phases of womanhood from periods to preconception to perimenopause. And my goal is to educate, my goal is to empower, and to be able to create a space for women to be that guide that I did not have.
That sounds awesome. So, with that collective, what does it all entail? Is it just like
Yes.
online modules? Is it weekly calls? What's involved with it?
So with the Wellness Collective, there's three pillars. I one help women to relax, to stress reduction through sound therapy meditation. So I do
Mm.
sound baths. So during my journey, I wasn't able to relax. I was always on edge. Can you imagine coming home and telling your spouse, hey, it's time to get it in, or doing all these things? And I just couldn't get it together. And I never slept because I was always on this high anxiety. And one of my friends invited me to a sound bath. And that was the first time I actually relaxed. And I knew I wanted to know more about sound therapy meditation. And sound baths are just musically guided meditation through different instruments. And so I fell in love. And so that's one pillar where I actually help women here in the Wellness Collective. Two, it comes from period health and education. So being able to educate women about their bodies, being able to advocate for themselves and empower and help them when they do go to those doctor's appointments. And then lastly, women going through the hormone shift. So perimenopause, menopause, to be able to again advocate, educate, and empower women. So I actually help women there. So you mentioned the Dutch test and the different tests. I'm an integrative health practitioner as well. So I actually do lab testing for my clients, just to get more information about their body. GI, of course, gut health is always on that ticket to be able to look deeper there, organic acids test. So I do a lot of functional medicine testing to help my clients through their journey, if it's through period health, if it's through for preconception or perimenopause. It looks like they actually come to me for one-on-one. So my practice is virtual. So of course they go through one-on-one time with me as well as modules and communication through my platform.
That's amazing. I love it. I love functional lab testing as well. It's definitely a foundational piece to the work that I do with women as well, because it gives us that insight. And I feel like it really validates women and their experience that they're having.
I agree with that because I feel like we're looking for something. Like for me, when I told you that when I was diagnosed with endometriosis, it felt like, okay, aha, that's what's going on here. But later on in life, when I'm looking at, the issues I was having with my stomach and all these other things, I think functional lab testing gave me that number or something I was looking for because we always want to say, okay, what's the root cause? What's the cause here? And seeing something on paper makes a difference versus your provider telling you, I don't know yet. Let's just wait and see. That doesn't
Mm-hmm.
sit well with me because I know there is something wrong. So my goal is to always give my clients a voice when it comes to this testing. I believe that truly gives them that.
Yeah, that reminds me of a client that I have who has really bad periods that have really
Mhm.
shifted in a negative way over the last year or so. And finally, we got her a pelvic ultrasound.
Okay.
So that was good. Their doctor ordered that, but there was nothing of note on the ultrasound. So she was just told, monitor your
Mm,
periods. And she's like,
I
what
know
is
something's wrong.
I've been doing that. I've been doing that. So I'm like, this is when we find a different doctor then. We need to find
Right.
somebody else who has more of an action plan for us and just monitor your period because that's not helpful.
No, and I feel like having that voice, that's one of the things I want to empower women because I feel like, I didn't my light or didn't say a whole lot because I truly trusted what my provider was saying. But now that I know the information, I'm able to share that with my clients so they can be able to go into their provider's appointments to let them know and advocate for themselves. This is what I want done. This is what I'm requesting. And if they can't give you a really good answer to why they won't do it, then change doctors.
Yes, absolutely. Well, I found that this was a really enlightening conversation, and I'm sure women out there who are struggling with fibroids or wondering if they have fibroids will find a lot of useful information from our conversation today. Dr. Katashia has put together a free fibroids download for you to check out as well. We'll have that linked in the show notes. Dr. Katashia, is there anything else you want women to know, and where can they connect with you?
Well, thank you once again for having me. I'm truly grateful. You can most definitely follow me on social media on Instagram at Dr. Katashia, or check out my website at www.drkatashia.com. That would be really great. And just know that you have a voice and just make sure you use it, because that's how you're going to continue to push through and empower not just yourself, but someone coming behind you with the same issue.
Yes, love it. All right, let's all go give her a follow. And thank you so much for this wonderful conversation.
Thank you so much.
Thanks for tuning in to another episode of Healthy Buzz. I hope this conversation has left you feeling seen, supported, and ready to take the next step in your health journey. Love what you heard? Make sure you subscribe to Healthy Buzz so you never miss an honest conversation. And if you found this valuable, please take a moment to leave a review. I truly appreciate it. For exclusive weekly tips and holistic strategies, be sure to subscribe to my weekly newsletter. The link is in the show notes. Remember, this isn't just nutrition, it's permission to trust your body. I'll catch you on the next episode of Healthy Buzz.